One of the outcomes from last year's CQC inspection highlighted that we should look to improve how we care for our patients who are aged over 75. Great Yarmouth and Waveney has a high proportion of elderly people, and there is a need to take a different approach to the inpatient management of those considered frail elderly, where the person has medical problems related to age, such as reduced mobility and incontinence. Al Green, a consultant at James Paget University Hospitals and a lead on frail elderly, has been working on a new approach to improve care for elderly patients, which is now being introduced across our hospital. Our current methods, while effective, do not identify those we would class as frail elderly, and therefore we tend to treat the ailment rather than the person as a whole. To address this, we have developed a new strategy so we can identify those who fall within the frail elderly category as soon as they arrive at the hospital. There are 4 steps to our strategy.
%70 of our admissions are aged 75 or older and can be classified as frail. Evidence suggests that the less time they stay in hospital, the better their outcomes. When the patient comes into hospital, be that from their GP or through the emergency department, the admitting doctor has 6 criteria to decide whether they are frail. They have to be over 75 and present with falls, incontinence, confusion, immobility, a new stroke, or come from a care home. If they have any one of these criteria and are over 75, then we characterise them as frail. Then we add them to a database which tracks their progress through the hospital. When younger people come into hospital, they only generally have one diagnosis. We can treat that one diagnosis and they get better and go home. Older, frail patients often have a number of different diagnoses, all of which need treating a little bit, and all have different priorities. We develop a person-centred care plan which takes into consideration all of these diagnoses. When older, frail people leave hospital, they often need help in their own home. The personalised care plan outlines how we might do this. When patients are admitted, we assign a planned discharge date so that occupational therapists and physiotherapists can organise a care package for when they are discharged. After their admission to hospital, the patient is safely discharged back to their own home with the appropriate amount of care. Their personalised care plan is shared with both their GP and anybody who might be caring for them.
If you'd like to find out more about our new strategy, please visit the James Paget website, where you will find a page dedicated to our plan of care for frail elderly patients.